Good evening and welcome everybody to a really exciting presentation that I personally have been looking forward to, because I had a conversation a couple of months ago that touched on these subjects, and I can't wait to learn a little bit more, a lot more actually. So tonight we are very, very honoured to introduce Dr. Lisa Steele and Dr. Mark De Brincat. And tonight they're going to be talking about voice analysis and brain mapping in terms of mental well-being. So I think it's something that we're all very keen to understand a lot more about. Afterwards, we are going to invite our audience of practitioners, stroke experts, which cover a number of modalities, to a Q&A session, which should make for a very interesting discussion, I think. So just as a brief introduction, first of all, Dr. Lisa Steele is a PHA Ambassador, but is also one of the UK's leading naturopathic doctors who's been in practice for over 30 years. Lisa's responsible for setting the direction and principles of the Optimal Health Group and inspiring the team as an optimal health visionary. Lisa's passionate about guiding and educating patients on complex health issues and optimizing health naturally. Educating patients to be able to take responsibility for their own health and well-being using non-invasive, natural and supportive means is her mission. And so you can see why there was a natural synergy with the People's Health Alliance. And we've been working with Lisa from pretty much the start. So let me now introduce Dr. Mark De Brincat. And I was worried about saying that name, so I'm going to just call him Dr. Mark from now on, because it's a bit of a mouthful for me. So Dr. Mark is a chiropractor and neurofeedback therapist who specialises in brain and spinal trauma. Mark believes that all healing starts at a cellular level, and his passion is to serve and teach others in living a pain-free life using natural therapies. So again, the vision is exactly on point. Dr. Mark brings through his work the Good News Doctor, which we will share the link in our description of this video. And he uses his knowledge of the body's ability to heal itself and live pain-free. So I know that Dr. Mark has his own remarkable story that's led him to where he is today, as so many of our practitioners do. It's usually through personal experiences, isn't it, that we start to look more into and research more and become knowledgeable about different modalities. So without further ado, I'd love to introduce you both to Lisa and Dr. Mark, and I'm going to hand over.
Thank you, Lisa. Thank you, everybody. Lovely to see so many familiar faces. And of course, we're delighted to support the People's Health Alliance in the launch of the Mental Health Project. It couldn't be closer to our heart. And I know that some of the things that we are working with in clinic will make incredible contributions to support this mission. We are also this month launching a Mindwork Centre of Excellence in our Hampshire clinic to coincide with the Mental Health Awareness Week. And what we are doing with our group of clinicians, which is growing by the minute, we're using techniques and technology to basically look at root cause issues, and then through the use of specialist techniques and technology, support people on a bespoke treatment pathway to restore their wellness. So that's our kind of mission. I don't want to spend a lot of time on me and us, because this is really time we want to spend on telling you what we're actually doing. But I just wanted to go back to the webinar we did last year with Dr. Hans van Muzel and his innovative sound technology, which is what we call our voice analysis. And I just wanted to kind of get into the swing of what he is actually saying and what we know about the power of the body to heal. So just a little summary, technical summary. So matter consists of molecules, and these are composed of atoms. And atoms are composed of protons and neutrons and electrons. And the protons of each atom has a unique specific resonance frequency, which identifies such an atom. So based on this assumption, what we know is that you can map the frequency of protein resonance. So that is atoms, genes, neurological processes, and even emotions that are all part of the functioning of the human organism. And what we do with the voice analysis through an atomogram and through the software is we can identify a neurological process which relates to a pathology dysfunction or an emotion. And we can reproduce those resonance frequencies in order to instruct the brain to provide for itself its own cure and balance of the organism and all the resonance states between the vacuum and the matter. That is what we're working with in the VA. So what the VA is doing, it's assessing the emotional and physical state of the being. It makes a reading through the atomogram and by the capture of the voice, and it's measuring and analyzing the patterns in those voice frequencies which relate to the person's range of emotions and impulses. The EEG measures the brain waves and the patterns, and we'll come on to this with Dr. Mark and the brain mapping, because it's a similar thing that's happening. But the voice analysis system makes comparisons between the known frequency patterns and the patients to determine the correct frequency balance that can be then restored back to them. So the treatments that we use in clinic are based on low frequency sounds and vibrations. And what the brain does is it is able to generate very complex tones, which then command the systems of the body through the frequencies, through waveform patterns, which we know as delta, alpha, theta, beta, and gamma. These are the EEG measurements. But what they do is they provide the relationship between the immune system and the brain. And we all know of the link between the gut and the immune system with the blood-brain barrier and how that affects the brain function. So effectively, we know that the brain can modulate the immune system. And the science behind this sits really in the theory of stress. What we also know is that there is a lymphatic system which connects the brain and the immune system. So the meningeal lymphatic vessels are a network of conventional vessels which are located in the dural sinuses, but they link to the meningeal sinuses of the sympathetic nervous system. So we see the link from the brain with the emotions and the psyche through to the autonomic nervous system. And in that process, obviously, there will be a series of symptoms that will be produced by us individually. The other thing we learned from Hans was that the DNA is our genetic code, and that the strands are twisted around an axis, and that the 4 letters from the alphabet contain all the information necessary for the cell. But what we also learned was that only 5% of that DNA is used for coding and reproduction. And then we have 95%, which is known as junk or dormant DNA. And there's a Russian doctor called Dr. Garjajev who has shown that we can basically reprogram the DNA. We do not have a fixed DNA. It is reprogrammable, and it's reprogrammable through sound and light. And that is where inherent genes can be changed, and it is possible to repair the DNA material. So that is what the voice analysis does. And we use that as an adjunct to support people primarily with mental health issues, which have manifested into functional physical issues. But what I'm going to do now is hand you over to Mark, who is going to talk to you about brain mapping, which is another aspect which should be available to everybody so that they can really understand how the brain is interpreting that journey at the cerebral level, and give us the options of how we can start to look at how to repair the DNA. So I'm going to hand over to Mark, if that's okay.
Sure. Thank you, Lisa. And thank you, everybody, for having me here today. It's truly an honor. I'm going to go ahead and share my screen with you all. And so I'm going to first just start out simply with a little bit of a testimony of myself. As she mentioned, I'm a chiropractor specializing in brain and spinal trauma for over 3 decades now. And years ago, my wife and I were in this head-on collision, terrible accident, and she broke her neck, and I shattered my pelvis and had a whole bunch of other injuries with my spinal cord and was disabled for many years. And so being a brain and spinal trauma specialist and then becoming my own best patient, I've had to truly search the globe to find breakthroughs and to find answers. And they told me I should just be grateful I'm still alive and what I can do, which wasn't much. And I refused that. So I'm a fighter, and I kept pushing the limits and pushing the limits. And I'm happy to say that 10 years ago, I got my legs back and my arms, and I got out of my permanent chair, got off all my medications, and have been living an amazing life that everybody told me I would never have again. So the body is amazing. It's resilient, and it can overcome things like traumas if we focus on how the body heals. And the body's healing actually from the inside out. And that's what most people need to be reminded of. It's like when we heal, we're starting at molecules which are transcribing themselves into a new cell. And if you have enough of these redox molecules, they're called, we can actually create 3 billion copies of that DNA to find the cleanest one that makes it into the new cell. This was my epiphany when I was at the worst part of my crisis and feeling sorry for myself in a permanent chair and all of that. I realized that my body's going to be making new cells and doing that all the time. And if I can focus on the next version of my tissues to be better than this one, I think that's where I'm going to find my breakthrough. So the molecules turn into cells, which turn into tissues, which turn into organs, which turn into organ systems, and then, of course, an organism. And so tapping into that innate intelligence and the healer within is truly the answer to why and how we heal. Now, this is an amazing video taken inside an infant watching neogenesis of a new nerve grow. Now, every second is equivalent to 30 seconds in real time, but we're seeing a perfect example how these redox molecules are the beginning of life. These are transcribing into new tissues, laying down these new cells. And these can be absolutely amazing, but it can also be very vulnerable. And in this situation, we're going to put a heavy metal into this child in the form of mercury. And what we're going to see is this new growth and this life of all these nerves that are growing to form that nervous system, which is doubling every 6 months, by the way. We can see them immediately be denuded and reverse in that whole innate process. So when we talk about healing, healing always begins in the brain. Our central nervous system is the most important part of our entire body. It trumps all other systems, for it communicates and guides and directs the function of every one of our cells in our body. Now, our brain's composed of two different types of tissue. The gray matter is the outside, and that's pretty much like the rind on a melon. This is the part of our brain that we control. We think, we say, we feel, we do, we act. All of these things come from our cortex. It's processing about 2,000 bits of data per second for every little crumb of brain tissue. Now, the inside, the white matter, far more impressive, 400 million bits of data per second, and it's controlling and regulating all that the human body is doing that you don't have to think about. So we can do something called a QEEG evaluation, and this is a 19-point channel where we have microphones all the way around the brain, simultaneously recording brain activity, non-invasive, and it's going to basically show us how people are wired. And this is truly amazing in giving insight into your whole health. And if we're not looking at the brain, there's most likely a big black hole that we're missing, and that's why things aren't responding like they should typically. Now, technology's grown so much over the years. We now have a dry cap that allows us to do this without putting gel into the hair and having to shower immediately afterwards. But the data in which we can see is truly amazing. We can see injuries. For instance, in a traumatic brain injury, if you get hit on one part of your brain, the damage doesn't just happen where you were hit. It hits off the backside of the brain and comes back to the point of impact at the two different speeds, okay? And so this is gonna create different types of damage in the brain. Now here we can reconstruct a 3D image of people's brain once we have the map, and then I can tell exactly everything going on in this person's life, from the things that they're good at doing to the things that they've lost the ability to do. We can see how bad an injury was. I can peel layers of this cortex down to see how deep the impact actually affected. Red is going to be areas of inflammation and where the impact originated. The dark blue is going to give us the vector in which the angle and they were hit, because the dark blue is where the brain bounced back to the original site. And so that causes usually more damage in the area opposite of impact than the impact itself. Now, we can take these regions where we see are dysregulated, and we can actually label them. Broadman areas is what they're called, kind of like a map. You got regions of tissue, and each one of these little colored spaces occupies a very specific function in the body. So we can see which ones are the worst and how many deviations above normal are they. So again, this gives us the ability to manage expectations moving forward. And just like Lisa mentioned before, where we can see the delta, theta, alpha, beta brain waves, we can tell you exactly what you feel and why you're feeling that way and how you're acting and why you're acting that way based on injuries and so forth in the brain. Now, dealing with brain and spinal trauma, almost every one of my patients has mental health issues. Most of them are secondary because now they can't physically do things that they once could do, and that causes a lot of anxiety or depression and so forth. Some of it's direct, but we can literally see and illustrate exactly what the person's feeling objectively. When it comes to mental health, there's an arousal state. There's a certain time and a place that I should be excited. I produce adrenaline. If I hear good news, it should last about 3.5 minutes. And then I should wear back down to normal, what's going on in our environment. If somebody had something tragic happen, I should feel sad for them. I can lower that idle speed of my brain and relate and be there for them. And then get them, focusing on good things again and get them out of that state. And so we're constantly on this track that's gliding from excitement to idle to sad or slower arousal back to idle. And the problem is when you're only asking people questions objectively or subjectively, you might get the wrong diagnosis. In fact, most of the time, half the time at least, people come in to see me, they're on a medication for an arousal state disorder, let's just call it that, and it's the opposite one, because they don't adapt. They're going to drive in a certain direction and lock you there for a certain amount of time. That's the nature of medications. Ideally, I'd love the brain to be free, to be able to adapt and go either way at any time and not feel like we're in a bubble. So in doing this map, we can clearly see if somebody objectively is suffering from anxiety, depression, or bipolar without ever having to ask them a question. And so that's truly amazing. We can also see risk of cognition and cognitive decline. And we can label cognitive design or conditions up to 15 years prior to them happening. Okay, so we can really get a good insight on these different areas of the map that we can see that usually go south before symptoms arise. We can also see things like interconnectivity between right and left brain. You have the ability to connect them through the corpus callosum. There's 32 connections between all the brain waves that we're looking at. And we want those to be in the 20s or so to be relatively good decision making, speed, accuracy, and all of that, not being indecisive. But more importantly, it allows right and left brain to work together and go heal the body as one system with all the resources. When we're disconnected, we're either calling the person analytical or creative, but they're really not tapping into the full resource of their brain. When we see this happening, there's certain therapies and things that we can do to help bring that back. Now, we did mention neurofeedback training. This is an example of a soccer team in Milan that has the entire team getting brain mapped and then doing aggressive neurofeedback training to target new tissue growth and to restore functions in the brain that may have been lost. So we have the ability to diagnose a concussion. This is the software that military and professional sports use to determine, can you be on the field? Can you be in active service? You have to be in the grade of play. If your concussion brings you outside to any level of concussion there, we can also see what networks in the brain are affected by your concussion and what you can or can't do right now, well, based on the area in which you were hit. So a little over 8.5 years ago, I had a patient come into my office and she shared what redox signaling molecules were with me. Now, in the world of neurofeedback, we are limited to typically 30 minutes a session, a couple times a week, without overdoing it. Remember, the brain causes more oxidative stress 2 million times over, more than any other cells in your body, okay? They have 2.5 million mitochondria per cell, where most of your body has about 300. So that is a huge difference. And so when we start hooking up wires to the brain and targeting certain areas for neuroplasticity, in typically about a 30-minute, we've created so much oxidative stress because they're lifting weights with their brain, basically, and working out, that it triggers inflammation and then a headache comes. So we're limited on a small amount of time to be able to do that. Now, since I learned about these redox molecules, we've been able to have people train 2 hours twice a day, every day of the month, and never hit a wall. This has been unbelievable. We can now do 2 years of neurofeedback training in 1 month, and it's only because of these amazing molecules. So what are redox molecules? Well, when we talk about brain health, it's basically this. The cells that make up your brain are the same cells you were born with and the same cells you're hopefully going to die with. Now, they do not replace themselves. So their main function, send information. And that's all they do all day long. Now, when you're in your sleep cycles going through your night, you actually repolarize those brain cells. So when you wake up in the morning, they're good to go. It's no different than plugging your phone in at night and you got a full battery in the morning. It's the redox molecules that are charging those cells. And so they're going to go as long as they can until the battery's dead. And they're just going to sit there and it still looks like a phone, but it doesn't function yet until I get it charged again. So the #1 goal when we start restoring brain health is restore redox potential first, and then we get into neurofeedback so they can really push the limits and grow new tissue as fast as possible. Now, there's a company called ASEA. It's the only company in the world that's ever been able to make redox signaling molecules. And why is that? Because these are what your body makes in every single cell of your body. And they're so fleeting, they're gone in a trillionth of a second. So to find these molecules like hydrogen and oxygen and keep them stable in the same medium, it's truly an amazing accomplishment that nobody in the world's ever been able to do accept this amazing company. So I started off and did a study, been using these for years, but we're doing it in conjunction with neurofeedback and any other therapies that would help the patient at the same time. I did a study over the last 6 months where we've had 60 people come in, take 8 ounces a day of this product, and then remap them at the end. So they weren't allowed to do any other therapies or new products during this time. And so when we say, what are these molecules? Well, every single cell in your body is breaking food and oxygen down into the Krebs cycle, which spits out hydrogen, oxygen, chlorine, and sodium. This is saline. That's why they give you saline in the hospital to hydrate you, because that's the fluids of our body, okay? And this is how our body creates these molecules to build every antioxidant and every defense system to protect you and to help rebuild, remodel, repair, and rejuvenate. All of these things come from within the cell, and every cell in your body makes those 4 molecules. Well, ASEA figured out how to take the sodium chloride and break it back down into those same 4 molecules that are native to every cell in your body as the primary defense system, and stabilize positive and negative electrons in the bottle without neutralizing each other, which truly makes it amazing. So what redox molecules are is they're tiny molecules that absorb through any cell. They turn on and turn off switches. So think of it like the people doing the work in your body to heal and repair you. And it's causing a cascading effect to all the neighbor cells, and resilience to stress is the answer. So the only difference between a healthy person and a person who's not healthy is one thing. You either have a charge on your cells or you don't. I mean, that's where it all boils down to. When the charge is gone, you can't fight back and you don't have any potential left. So the 2 main functions of redox in your body, half of all that you make every day charges your cell so that your cells can communicate all day long. And the other half turns back on the signaling, prevents degeneration of the cell and breakdown of that cell. It gives them full bars. The cell phone's no good unless I can connect to the service. Now I can communicate, I can ask for help, I can do all sorts of information exchange. Think of redox molecules as the language of our nervous system, and these molecules make up the letters of that language. So that's what it all boils down to. It's the simple ways for the cells to improve resilience and communication. So in this study, this is preliminary results. The study is not complete yet. I got about 30 people finished out of the 60. We're seeing a 52% change in nighttime neurology. That's the ability to get asleep, stay asleep, and wake up feeling refreshed. We're seeing 73, 67, 54, 36, but an average of 52% in that nighttime neurology between maps. That's incredible. When we see the brain change 5%, we're elated. 10 to 25% is average after doing 20 hours of neurofeedback. So to do nothing but take a redox supplement to repolarize our cells and improve cellular communication, it's redox molecules that are turning on and off all the switches to produce hormones, neurotransmitters. We talk about mental health, emotional health. It's not just producing them, it's turning them off when you have enough. It's carrying them across the nerve junction. Their redox molecules are cleaning up the receptor sites so that the neurotransmitters can be received and actually utilized. So during the day, very similar, 51% change in neurology, which is truly amazing. And I've done 30,000 brain maps and published studies on different products being able to affect the brain or not. And this is truly remarkable. Interconnectivities between right and left brain, we're talking a 44% increase on average. This person literally went from 0 to 28 out of 32. And we're seeing similar connections across the board when it comes to pretty much every category in the brain map. Another example is one of the people in the study actually had a concussion before the study started, and we evaluated at a 3.8 level of concussion. And you can see it was anxiety, language comprehension, mood, and executive function, which is working memory, working mental flexibility, and self-control and memory. And so all of those went to a 0 concussion within 90 days, and all of those symptoms that they were having of the moods and the anxiety we see tight and right back into the middle. Anything within the gray spider webs are considered normal. And if you've never had a concussion, you'd just be a simple dot right in the middle of the screen. So this has truly been a game changer for us. And for so many patients, being able to achieve, you know, back to feeling normal in themselves and being able to sleep and being able to not have panic attacks and go into old patterns of thinking and behaving, you know, simply based on seeing things that are reminding them of those things. And so, like I said, we've had so much fun being able to bring awareness to people. And now with Lisa, she's been able to introduce this into her practice as well. And so if anybody's interested in learning more about brain mapping or even neurofeedback, just get back with Lisa about that and she can help guide you into the right directions. And if you're interested in learning more about this supplement, that really should be called alpha redox, because remember, the redox molecules are the first things that your body makes to build all the other cells and to communicate with everything. And so when we find a product like this, you truly cannot go any further upstream to get to the root cause of any condition in the body. We don't have to label it, but this is how the body heals. And so I know all of you are about root causes and trying to find natural ways to get people better and keep them well. And so I believe that's why I was invited on the call and why these amazing technologies, you know, have such an impact on mental health. And I believe that it has a lot of synergy with everything that we're all doing. I have all my doctors and patients that use these products, you know, begin with redox, and then everything else that they're doing is more well received. The body just becomes so resilient and responds to all therapies better. So I'll leave you with that, and I'm always happy to, you know, answer questions, because we're going to open it up to a little discussion. So thank you for letting me share.
Thank you, Mark. Wonderful. I think that gives an amazing overview of what is possible. And I think if anybody wants to experience it, then I think it would be an amazing thing for you to come and see how we capture that information, what the reports look like, and what the opportunities are to repair. So yeah, if anyone's got any questions at all, I mean, it's quite a big subject, but please do, you know, please do ask away.
Absolutely. If people want to raise their hands, then we can just try and make it as fair as possible. But I just thought that was absolutely incredible and blown away to learn more about it. But yeah, please, let's have some questions.
While we're waiting for that, I will mention that I've been doing a podcast on redox molecules every week for the last 2 years. And I change the topic every week on how your body makes them and how your body overcomes whatever condition and health issues using these molecules. So we have a vast library of information for your interest, to pique your interest and to learn more about things specifically related to your patients.
Amazing. Well, we can definitely add that, with your permission, to our resource library. Fantastic.
Absolutely.
Has anybody got any questions? I'm just interested to hear what people in different modalities think about this. I mean, you know, we're all doing our own thing. We're all learning, but you know, no questions?
We have practitioners, over 90 types of practitioners already using these amazing products.
I mean, Gareth, I was thinking about where you're working, how significant this would be for you.
Yeah, I can't find where the hand raise thing is, but hi, Mark. Yeah, can you speak to
raise your hand, unmute yourself, and shout?
Yeah, right. Okay, there you go. Yeah, hi, Mark. Thanks for that. Very interesting presentation. Yeah, can you speak to those one slide that talked about cognitive difficulties? Can you speak to how this might how you might approach a patient with dementia or anything along that
So we
range.
have, throughout the brain map, there's 3 different areas of the brain map that give us a warning if any of these things are close, okay? So we call it strike 1, strike 2, and strike 3. The first one shows us the literal connections between gray and white matter. And so the 2 different tarps of your brain have billions of little nerve connections constantly communicating to each other between the gray and the white matter. And if we have a TBI, that's usually the worst. And so that causes a lot of damage in those connections. It could also be an infection in the brain. It could also be heavy metal poisoning. And it could be a whole season of like chronic emotional stress. It can shut down those connections where they just stop talking. And so we don't know when we first look at it if they're damaged or just turned off. So it's considered strike 1 when the whole area goes south and we've just lost communication between the 2 to a certain extent. Okay, and so that's like warning sign 1. Warning sign 2 is when the magnitude, which is basically how you're choosing to regulate the gray matter. This is the part that you're thinking, feeling, saying, doing, thinking, everything that you control. We can divide that into all the different brain waves. And there's an incident we call brain on fire, when across the board it's aroused. And it's ADHD, it's anxiety and depression, and all these things. It's just constant worry and stress. And so we'll see the whole magnitude light up. And that's usually not good either, because they're just wide open. They don't have a very long attention span, and they bounce around all over the place. They don't have the ability to just stop and focus very well for any length of time. And so that's strike 2. Because what happens is eventually that all burns out. And when across the board that all turns dark blue, now it's just too late. There's no potential left. We're measuring the potential in the cells. So when you're looking at the brain maps and you're seeing reds and yellows, we think of inflammation in the brain. When we see the blues, it's more degeneration of those tissues. It's slowing down, it's atrophying, they're not firing right. And so that's a much worse problem. It's always harder to wake up potential than it is to calm it down. Okay, and so the key is if you just let it go its course, they'll eventually burn out. It's just the process, and they'll burn out too soon. We can stop and negate that and actually help the body return back to homeostasis. I mean, it tries as hard as it can all day long, and it uses every little drop of redox that you're making to keep you in that place called homeostasis. Now, we know the heartbeat is 60 to 100 beats, 14 to 17 breaths, 3-degree temperature we need to maintain our body in. But the pH of your blood, that's what people don't appreciate. It's 7.35 to 7.45. You got 1/10 of 1 degree to deviate before you can't carry oxygen in your blood anymore. That's a problem, right? And so this is all redox. You're using redox with all the buffering abilities you have to get you back. Anytime one of those vital signs comes out of normal range, you're going to use everything you have to get you back as quick as possible. Now, the problem is people eat things like sodas and sugars that are so acidic, like 10,000 times more than the blood. So the body goes into crisis, and it might take hours of using everything you're making just to get you back to homeostasis. What's left over to heal the body? Okay, that's what it all boils down to. We can keep in homeostasis with lots of reserve. We're healing the body all day long. And that's last. Healing the body's last. Keeping you alive is primary. Okay, and so it's going to do everything it can with all your resources to stay in homeostasis. And so when you're out for too long, oh my gosh, you're degenerating, you're inflamed, and you're creating this pattern of inflammation that you're always in. And that's called autoimmune, right? So all of these things boils back to how well is your brain communicating to the rest of your body, and how can we improve those signals? We can do it a lot of different ways. When you're eating healthy, you're making good glutathione and all sorts of other redox molecules to help you. And when you're eating bad, it's costing you. So either you're making it or you're paying the price. But knowing where you're starting from and then being able to measure, milestones moving forward it brings people such a peace of mind. But, you know, outside of that, the symptoms and the feelings, I mean, everything starts happening very quickly. It just takes longer to restore function. Your body wants to feel good. Function comes a little bit later, because feeling bad, you know, the nervous system only has 10% of the fiber for how you feel, a sensation, hot, cold, pain, pleasure. 90% is function, right? So if there's pain, you've lost a lot of function first, and it doesn't mean it's all back as soon as the pain goes away. That's the first thing to go away. It just takes, you know, consistency to rebuild resilience into somebody. But we've been doing this for years, and there's no greater gift than seeing people get out of wheelchairs and get physical abilities back and be able to actually get back into school and go back to work and manage a company and do all sorts of things after their brain stopped working well after certain head traumas or what have you. So it's an amazing space to be in, and you'll find patients that will be more grateful than anything else you could ever do for them to give them their brain back.
And isn't it the case that, you know, a lot of the neurological conditions that we see are because of toxicity? And so the brain can't function if it doesn't have enough redox capacity. And so the intoxication gets worse. And so the neurological symptoms get worse. And it's just that draining of the capacity to overcome it. But given the capacity, the brain can then naturally detox. And so the symptoms that people are sitting with in depression, anxiety, on the spectrum, all of these different things can be changed on that premise by providing the potential and the capacity. And I think that's, for me, I mean, it's like the, you know, it's like the polio story all over again. You know, these people are intoxicated by toxic metals and spending so much time and effort trying to detox, but they just don't have the potential and the capacity because the redox capability is so compromised and taken hostage, and so it just keeps recycling. So it's a case of getting that, you know, as you say, you know, charging up the patient, getting the potential back, making sure the redox works, and then the detoxification takes place, and then people are relieved of these symptoms that they've held for years.
It's true.
I'd just like to ask, we've got Glyn here as well, and just talking about toxicity and environmental factors and things like that. I don't know what your thoughts on this are, Glyn, and I'm sorry to put you on the spot here, but obviously this has a huge impact on us. EMF toxicity.
Yeah, first of all, let me say thank you, both Lisa's and Dr. Mark, for bringing this to us. It's, as you know, Lisa, it's not often I'm speechless, but I am in a very good way. And I'm thinking about, I've got 15,000 clients now, and I think probably 14,999 of them need some of this. I would love the chance, Dr. Mark, to maybe have a Zoom call, just you and I, and I'd like to talk about the whole EMF spectrum. I mean, mainly what the main function my business has is to help people who have become electrosensitive through overexposure to electromagnetic frequencies of very many different sources, principally dirty electricity, radio frequency, and body voltage. But all of these people are not waking up refreshed, they're not functioning neurologically, and their immune systems are mostly destroyed. So I think I need you from that point of view, but I think also, you know, looking at how we could perhaps help you guys to minimize exposure to electromagnetic frequencies that are interrupting with brain function, and more importantly, how people feel when they sleep or don't sleep, if you like. So yeah, and in conclusion is stunned and shocked in a very good way, and I hope we work together.
I'd love to see an interview between you two guys once you've had a chance to get together and talk about the effect of EMF.
Yeah, so I could definitely speak on all the EMF stuff as well. It's my understanding that when you're around these waves, it's not causing a thermal effect. That's how the cell phone companies can get away with it, but it's more of a vibration of the cell so fast that it's opening up the voltage-gated calcium channels and allowing too much calcium, 1 million ions per second, into the cell, which causes all sorts of free radical problems. And so the cell walls are regulated sodium potassium pumps, where we need the 2 sodiums on the inside and the 2 potassiums on the inside and 3 sodiums on the outside to keep that positive charge on our cells. And so that's a redox function. And if we don't have enough redox, we can't maintain that. And then the EMF and all of those things just have a field day and come busting right through our doors and bringing all the stuff into the cell that we don't want, right? And so it's causing all sorts of havoc and not allowing our body to detox the stuff out of the cell too fast. So think of redox molecules like the workers in your cells and in your body that get the job done. They're not going to be part of a new cell as far as like the brick and mortar, like your proteins, vitamins, and minerals. It's more of the labor force for your nervous system and for your communication of cell to cell. And so when we put more of that in, it's like, oh, you know how when you're getting really busy working on a project, I'm just focused, so focused that my room's getting cluttered and garbage is piling up and I don't care because I'm so focused. And then I finish it and I look around like, whoa, this place is a mess. I want to start cleaning things up. When you start taking redox, all your cells start looking around like, hey, I got extra workers here. You want to help me clean up the room? And so everything starts detoxing first and starts cleaning things up. So those initial days, you know, we go a little slow, and then all of a sudden there's no toxicity. There's no amount that you can't take. Any orifice, any part of the body, it's truly life-changing. Almost 9 years now that we've been using these with patients. And like you say, it's just speechless, because I have seeked out for 30 years things to break the biohack. You know, how can I get more out of my body, and how can I stop these things from happening? And so the more and more we learn about technologies and products, the more you appreciate the redox, because that's truly at the beginning of everything.
Yeah, maybe we could, we have some clients that are extremely electrohypersensitive. So I think if we, perhaps, you know, now's not the time, but if we can talk at another time, and maybe we can do a little trial with 1 or 2 people and see how they react to, and we have a lot of clients in the States as well. So
Sure.
Yeah, fascinating and really excited to learn more.
Yeah, nice to meet you, Glenn.
Thank you.
Sorry, Roberto, I know I didn't realise you had your hand up. I can only see the top row. So
So I found the button.
well done for raising that yellow hand anyway, because I don't know how to do that.
So I've just got a practical question. So, I mean, what we can take away from this as practitioners is that obviously, like taking redox, patients taking redox or clients taking redox can benefit from a faster recovery through our different modalities.
Mm-hmm.
And the audience watching this, it was also mentioned, obviously, redox is produced during sleep. So people that are suffering from any type of ailment need to make sure, obviously, that they're getting a good night's sleep. But I was just wondering, if somebody's watching this and, you know, maybe got anxiety or eczema or whatever it is, and they're thinking, yeah, I really want to get hold of some of this redox supplement, practically, how much should they be taking? When should they be taking it? And kind of, you know, what would be the protocol for that?
So our typical protocol would be, I guess it's shifting now to 6 ounces a day, and it's a liquid. So you would do 3 ounces in the morning and 3 ounces in the evening. And you do as much as you can fit in your mouth, and you swish it around and hold it there for about 30 seconds, and then you swallow. Within that 15 to 30 seconds, 85% of those molecules are already absorbed sublingually into your system and used. They're going wherever they need to go. Most of them are going to the brain. And so that's a standard. Some people need more. Younger people need less. And if they're, you know, children, depends if they have health issues or not. Okay, we all need it. We're losing some. You know, every decade of life, you produce 10% less mitochondria. And so you're gonna, you know, at 50 years old, we only make half of what we used to make when we were 20. And so as me being over than 50, I personally need a little more. With me having major injuries to my nervous system, my sweet spot is around 12 ounces a day. There's some people with angry cells and overtaking their body, they need maybe a bottle a day, but it keeps them healthy. There's like, we call it the Goldilocks amount, not too much, not too little, but just the right amount for each person. But initially, for those first 90 days or so, we like 6 ounces. That's just going to help give you the reserve and the extra so you can stay in healing mode all the time and not just be trying to get back to homeostasis. So it's very simple to do. It's just a liquid. There's also a gel that's twice as concentrated. And when it comes to brain health, I like putting a little on my fingers and rubbing it right into the jugulars. That goes straight into the brain immediately. You can just do a test and have somebody squat down and stand up. And how easy was that? How stiff did you feel? Put a little dab, rub it on their jugulars and say, 10 seconds later, now do that again. They're gonna be like, what did you just do to me? Like, that was so easy. I didn't feel any stiffness. I have better range of motion. It was like, your whole body systemically changes pretty quick. The gel's twice as concentrated, so you can put it on any area, skin, for the bites, burns, blisters, rashes, stings, cuts, bruises, discomfort, it's right on that area. And typically within seconds to a couple minutes, it's gone. Okay, and so hopefully that helps. If we're doing neurofeedback, we talked a little bit about neurofeedback. This is just targeted areas where we put you on a task of, say, watching a movie, and then the movie keeps fading dark and bright based on whether your brain can hold the thresholds I set. And so it's putting you into a state that's making new tissue grow constantly in your brain, because it only happens when you're challenged and you're one step beyond your capability. If it's too hard, you quit. If it's too easy, nothing happens. So neurofeedback puts your brain in that state where you're desiring to watch something and your brain sees an optimal viewing experience, and then all of a sudden suboptimal, it dims 25% when one of the 4 areas goes back to where it used to be, 25% darker. Your brain's like, hey, I had an optimal viewing experience. Now I would call this suboptimal. What happened? Oh, there it is, it's back. So within 100th of a second, you're being disciplined or rewarded, giving the picture back or taking it away. And in doing that, people stay in these zones and they grow tissues. They wake up the next morning and they can move their leg down. Like, it's truly remarkable to see how the body can recover and rebuild from nerve damage and from any tissue damage for that matter. And so the neuroplasticity is the fastest way, technology-wise, to get you from A to B and restore neural function. I can do things in a month, which typically take a year to 2 years when we add the neurofeedback component into it. Now, it's because the ASEA and because we can do it for hours a day is why we're getting such great results so fast. Prior to that, it was months. It took 3 months to get 10 hours of this therapy in. Now we do 4 hours a day every day, right? So it's truly just how much time are you spending on the machine to determine how much new tissue is growing. And we can track that new tissue growth from map to map and show you how far you've come. And these are permanent changes. It's not like taking a supplement and it lasts for a few hours and wears off. When we see neuroplasticity, that's going to last 30, 40 years now, provided you don't have a new trauma.
And is there such a thing as taking too much redox, or?
No, it's what your body makes to the trillionth of a second, every second of your life. And without it, you'd be dead in 3 minutes, right? So it's native to our body. Our body's going to be like, not like, hey, what are you doing here? It's going to be like, hey, what are you doing here? You're supposed to be over there. Come on, go upstairs, go to the brain. It's like, as soon as it comes into your body, it doesn't have to break it down and digest it. It's just got to direct it. Go here, go there, because it already knows where it's going and what it's going to do. Your nervous system has a priority of things it's trying to heal. And although I might want my hangnail healed, it might be more concerned about my liver that I don't feel, right? So it's only going and working with whatever resources you now have, which is more. It's going to go to the top priority places that really need those resources, right? So it's impossible for this supplement not to work on somebody. That's another thing. I don't have many things that I could say about that, because most people could respond to a nutrient or not. Okay, everybody's a little bit different, but this isn't something like a nutrient. This is what your body has to make for you to survive. So it's impossible for it not to work. And it's impossible for you to be allergic to it because it's hydrogen and oxygen and sodium chloride. These are the things that our body makes at every cell in our body.
Okay, thanks.
What do we do after 90 days, Dr. Mark?
Well, they say that in 90 days, 90% of the people have found a breakthrough with this product. And for the 10% that didn't, I say stop taking it for 3 days, and then you'll know the difference. Because you might not see when you just feel normal, all the little things that you forgot were happening because you were focused on say one thing. I like it because in the box comes a chart with like 12 types of systems in the body, and it says rate your digestion, rate your energy, rate how sore you are after exercising. So 1 to 10. So you can do this before you start taking the product, after a week, a month, 2 months, and 3 months. That's your 90 days. And so I like people to stay on at least that 6 ounces for 90 days. And then they can decide, do I need a little bit more? Do I need a little bit less? Okay, and so it's just kind of experimenting. Unfortunately for me, if I don't take it for a day, I feel like I should still be in my wheelchair. My whole nervous system falls apart. I have bad neuropathy in my hands and feet. I feel like I got handcuffs on. I feel like I'm walking on nails that are going right into my feet. So I can immediately drink 10, 12 ounces, and in 2-3 minutes, it's all gone, right? So I have a good barometer where I can feel it, but not everybody has that way. But I found this almost 10 years ago, about 9 years ago, and it was the same year I got out of my wheelchair after being disabled for so many years. 17 years it took me to get out of pain. And this helped. When I started taking this, I was already out of my wheelchair and off my pain pills, but I could only walk about 200 yards and I could only lift about 10 pounds. Within about 2 months of being on this, all of a sudden I'm just walking. I didn't have a limit, and the pain didn't keep coming back. And it was amazing. And so it's given me my resilience for these 10 years. And it's what keeps me, feeling like I can actually live my life again. Right. So that means I got to take 12 ounces a day for the rest of my life. You bet I will, because that's the easiest thing to do, and there's no side effects. And so, except side benefits, is the other side of that equation.
I think Kerry has raised a really good point in the chat. However, for our audience who cannot afford to buy the product, what can they do practically?
Well, eat more things that actually grow from the ground. Right? Things that actually are real food. Stay away from the processed food and the breads and the crackers and the cookies and the sugar. All of that stuff is stealing your redox, and it's making you use all of the redox you have just to find homeostasis. So diet is huge. Exercise. When you're exercising, you make more redox. When you eat healthy, you make more redox. When you eat bad, it costs you redox. You don't make any of it. When you have road rage going home, that just costs you some more, right? You got to think about how much reserve am I going to have when I go to bed tonight to actually get a good night's sleep. And so, obviously lifestyle plays a big role in trying to be consistently, in bed, get a good night's rest, and try to eat right and stay hydrated, all of those things. Now, Redox ASEA has just created a wonderful package to make this actually super affordable for people all around the globe, where they're going to give a massive discount on that 6 ounces a day and give us free shipping. I think that's global. Is that correct? Global? Yeah. And so they're making this affordable for everybody. Because honestly, if you're talking about maybe $200 here in the US, it's going to be around $215. To be on that remedy with a tube of the gel as well every month. That's the most important supplement you could ever take. So if you're taking a bunch of other things, figure out what you need to take out to get this one in, because this is going to go upstream to the root of everything. And it's going to help your body actually break down the other supplements in food that you're eating better and absorb it better. Remember well, you might not know this, but the entire lining of your vascular system has what's called a glycocalyx, which is little hairs like a shag carpet with redox signaling molecules, which is the intelligence of your vascular system. It's what lets nutrients through and oxygen through and nothing else. And so this will allow everything else to function better. and possibly need less of those other things as well. But that is a great question. Thank you for asking.
Yeah. I'm just thinking at the moment about a friend of mine that has had a medical intervention that has caused quite a lot of damage, and has been diagnosed with, and Lisa knows what I'm talking about, you know, he's been diagnosed with MS.
So it would take a brain map to determine how far along, and is this somebody that I still have potential to turn around? If it's just been recently diagnosed, most likely we can always turn that around. Usually it's the ones that know it's really bad and it's been bad for a decade or so that it'll present in a map, then it's too late. So, you know, I guess what was the question?
I think it was really just, you know,
It can help, Lisa. It can help.
Yeah.
I mean, you know, we know that those injections have caused enormous trauma to the nervous system. And so, and then combined with the toxins that will flow from that journey. So it absolutely can help. The issue is always affordability in these situations. But you know, universally, it can help in all of these situations. Obviously, as Mark said, it depends on the map to the degree at which point, but even the small, you know, most people are going to get so much benefit from knowing it and then having a pathway to recover themselves back to the whole thing. You know, if we take responsibility for ourselves and we understand how to do that, we can do that. The body will repair. It will repair everything.
For some it comes down to affordability, so you've already kind of covered that. And,
but again, you know, part of what we're doing, isn't it, is to create the environment where we're providing this baseline that people can have access to free healthcare. I mean, that's what we're working on behind the scenes with all of these areas. So at some point there has to be a means of being able to support everybody who needs it.
Well,
we're just not quite there yet.
To make a simple suggestion, if these products truly did change your health and you told 6 of your friends about it, yours would be free for life. And so people need to afford it. You can find ways to help people that can afford it, and now you can afford it too.
Yeah.
So it's always about paying it forward.
Okay. Fascinating. Has anybody else got any questions? Super. I think we're there. Helen, I think your question's been answered in terms of the fountain of youth. Yeah, I think we need the fountain of youth, don't we?
I think the thing is to try and make this into a practical solution now, isn't it?
We do.
How are we going to make this information available, and how are we going to communicate it, and how are we going to support people to have access to it? Because it's wonderful that we know, but we need to be able to be the messengers to support other people. I mean, that's what it's about, isn't it?
Well, as I said before, I do have a pretty extensive library of classes on all these topics that can really cater to the people. And if you'd like me to do one specifically for your group, I'd be happy to do that. We could even do one of these calls just for patients that want to learn and keep it in the right perspective, in essence, you know, and how to
that'd be amazing.
that.
We can definitely talk about that. That would be amazing. I don't know if you want to jump in there, Kerry, because you deal with workshops and things like that. But I think, yeah, the more information, the better. And I'm sure once people see this recording, they'll want to know more.
Definitely, and we could all work together to promote it, and subsequent presentations and workshops for sure.
Yeah, that's great.
Fabulous.
Well, I'll let you all work that out with Lisa.
Definitely. Lisa S, not Lisa D, or both of us. But yeah, thank you so much, everybody. I think it's been fascinating, as we knew it would be, and yeah, I just think that this will help a lot of people. We've just got to make sure that it's affordable for all, that nobody slips through the net, because there's a lot of people need this.
Can I just say, sorry, Helen had her hand up and it went down again. I don't know if Helen's got a question.
I think we covered.
I did.
I think we covered it in the chat, but feel free, Helen.
I suppose I'm just trying to get my head around redox itself, and taking supplements of redox. Am I right in thinking that by taking them, even if you don't know that you've got a health issue, it's a preventative thing that can be something that you can just to keep yourself optimal? Would that be right?
Yeah,
and
absolutely.
then is there anything, and that's across the board in terms of, I don't know, from broken bones to cancers to whatever?
Yeah.
Would that be correct? That it's a kind of, it's a supplement that just keeps you heals and then keeps you in optimal health, and that's physically, mentally. So I suppose I'm trying to link as well, in terms of depression, anxiety was mentioned, and if somebody is presenting with certain mental health disorders, the mind mapping or voice analysis would first of all identify that, and then redox would automatically know where it was needed. Is that a little bit like Reiki?
Absolutely.
You send Reiki to someone and it goes to where it's needed. And is that, and how long would someone be looking at, what kind of turnaround if somebody is if somebody's living with anxiety or depression, for how long would they need to take it? And would the redox deal with that first? Or if there was another health issue, would it go there first? I mean, how intelligent, I suppose, is the redox?
That's a hard thing to say, because everybody's different and everybody's going to have a different level of degeneration that's already happening that needs to be repaired. Nerve cells and brain cells have 2.5 million mitochondria. So when we talk about oxidative stress, it's not just from the pollution that we're breathing in from outside, it's the own engines in our cells metabolizing, making waste that we need to get rid of. And so when that builds up, call it any condition you want. We have health issues. And so redox is basically reversing all of that oxidation as fast as it happens. 75 to 80% of every condition on the planet is oxidative stress. Inflammation is just the other 15 to 25, right? So when it deals, we have a whole nother lecture where I really get into that, into the mechanisms of oxidative stress and inflammation and the switches that turn on and off and how the body regulates that. So there's a lot of variables. It's hard to say. That's why they say 90 days. 90% of the people have already been healed, whatever it is that they're trying to do. I see the emotions happen first. Okay, usually people are always feeling better before all the physical things are remodeled. Every tissue in your body's got a turnover rate, so it depends on what tissue we're talking about and how long it's been damaged. Your eyeballs are 2 days, you got all brand new cells. Your gums and your tongue, 8 days. Your throat, 2 weeks. Your lungs, 8 days. Your heart, 6 months. All your blood vessels, 6 months. Your bones, 11 months, 3 weeks, 3 days. And so every tissue has a different amount of time that it has to be replaced. So it's those next versions that you're really going to see your breakthroughs in. Sometimes right away in this version that I have right now, just things start clicking and communicating, and all of a sudden I feel better. Like somebody just literally turned a switch, but that's rare. That's like 10% of the time. Usually people have to be on it for a month. 50% of the people after a month have their experience, but 90% after 3 days or 3 months, sorry, 90 days.
And it's irrelevant of the reason that someone may find themselves anxious or whatever.
Sure.
Okay.
I might just add, just to finish, it's been lovely listening to you, and I'm so glad you're excited about it. But I'm a former nurse, and I went to Dr. Mark. I had a brain map done, and I was fine, no medication, no aches or pains. But what the results were from a traumatic brain injury. He asked if I'd had one ever, and I had to really think back because it was almost 30 years earlier. I had 2 of those 3 strikes. My right and left brain was not talking. I was asked a simple question, and in terms of the brain, it was like I was going in the room behind me and looking in the filing cabinet for the answer. Things were slow, and now I'm absolutely from these molecules just being put into the body and enjoying the greatest of lifestyles now, and my dysregulations are there no longer. So, you know, for people that are wondering how long, you know, can you do something from a long time ago, I'm living proof you can, and I witness these little miracles every day, from young babies we're working with at 6 months of age right through to, you know, real retired generation of people. It's a lot to get your head around, but it's very, very exciting, and everything's possible when we all do the right things. So I think you're a great group of people that can take this to a lot of people, and yeah, there'll be some fabulous results, I'm sure.
I want to say thank you for having us. I do have to jump off because we have another call starting any second that I'm hosting, so I gotta go.
Yeah, thank you,
Thank
Mark.
you.
Bye, everybody.
Thank you,
Thank you.
everybody. It's been fascinating. It really has. And I think it would be fantastic to just deep dive a bit more with Mark at some point in the future. We've got loads of stuff to share in the description, Kerry, of this video. I've made a note of it all, and I'm sure you have. And thank you, everybody, for being here tonight. I think it's been amazing, and some great questions, and I think we've covered a lot of ground tonight, so thank you.
Thank you, Lisa.
Okay, thank you, Lisa. Bye.
Thank
Thank
you.
you.
Bye.